Hi, welcome to the SHIP's virtual health fair. My name is Vicki Buchholz. I am a supervisor of Wisconsin's Medigap helpline, and I'm here today to talk to you about end-stage renal disease, Medicare eligibility, enrollment, and options. So what is ESRD? ESRD, or end-stage renal disease, is a permanent kidney failure that requires a regular course of dialysis or a kidney transplant. Dialysis is that process where the blood is cleaned so that because the kidneys are not doing their job. Or a kidney transplant, where a person ultimately goes and gets a healthy kidney, then transplanted into their body. End-stage renal disease and Medicare eligibility. So a person who ends up on dialysis can get Medicare at any age. The youngest that we have served here has been at 2 years of age, all the way up into their 90s and beyond, that we've assisted people with the ESRD Medicare. Their kidneys no longer work and they need that dialysis or have had a kidney transplant. And one of these needs to apply to a person to be eligible. They need to have worked the required amount of time under Social Security or the Railroad Retirement Board or as a government employee, or they're already getting benefits through Social Security, the Railroad Board benefits, or they happen to be a spouse or a dependent child of a number holder, Social Security holder, who is already meets the eligibility as above. So these are the people that are eligible to get Medicare based upon ESRD. But ultimately, Medicare involves 3 enrollments. A person gets Medicare when they're age 65 or older. They can start Medicare. A person who's been on disability, Social Security disability for 24 months, on their 25th month, they are eligible then for Medicare based upon the disability. And then we've got the third route, for a person that ends up on dialysis is also eligible for Medicare based upon the ESRD. So when does this Medicare begin? For most people who go to a facility for their dialysis, there's a 3-month wait, and then on the 4th month, they would start Medicare based upon ESRD. And that first month doesn't have to be a complete month. If they start dialysis in the middle of the month, that still counts as month 1. So it's on the 4th month. But there are some people who can start ESRD Medicare at the beginning of this process. If they're receiving home dialysis, if they get a kidney transplant, they can have Medicare start immediately the beginning of that first month. Or even sooner, if a person goes into the hospital for a transplant and it's being delayed, they've been admitted and they needed to go through some other services that are needed, so they can start Medicare before that. So a person who is eligible, there's a note here that if you're eligible and you don't enroll in ESRD Medicare, then Medicare can still be retroactive. Medicare Part A can be retroactive up to 12 months. So we do assist people even after these timeframes be able to get Medicare to start when they need to have Medicare started. So ESRD, though, a lot of the questions we have with people when we talk to them about signing up for ESRD Medicare, we like to know what they have currently for coverage, because Medicare works differently depending upon the type of coverage they have. So in this slide, I'm going to talk about a person that may have an employer group plan. They have group health coverage. So if a person is eligible for Medicare only on ESRD, Medicare will not start until the 4th month of dialysis. Therefore, during the first 3 months, that employer group plan is the primary coverage. And once the person is eligible for Medicare coverage based upon dialysis, then there is what's called a 30-month coordination period. During the first 30 months, the group health plan, the employer plan, is primary coverage. They cover all the bills primary, and if the beneficiary enrolls in Medicare, Medicare would play secondary. After the 30-month period, they flip. Medicare becomes primary and the employer plan becomes secondary. Now, the point here is many people may decide to wait on Medicare based upon ESRD because they may have excellent employer coverage. So then we do inform people that they need to make sure they sign up for Medicare so Medicare is in place at that 30-month coordination flip. Because oftentimes that'll catch a person unawares thinking the employer plan is primary. But with ESRD, that 30-month coordination period occurs whether or not the person has actually started Medicare based upon the dialysis. So this is one note that we encourage people to call your local SHIP, your local SHIP program in your state to help understand this part of the coordination between a group health coverage and this Medicare. And there is that 30-month coordination period each time a person would sign up for ESRD Medicare. Sometimes a person's doesn't need dialysis anymore, then ESRD would end. So if they start up again, still covered by a group health plan, we still have that 30-month coordination. So this goes in further about the 30-month coordination. What's ideal about having Medicare, even with an employer plan, is because it does help cover the deductible, the co-payments, and co-insurance after the employer plan does. So you need to understand your employer group plan to know how good is that coverage, to know if it would be important for you to have both Medicare A and B, because if you have that, then that would help with all the out-of-pocket after the employer plan. Now, some people do delay because they have excellent employer plan. So if you delay enrolling in A and B, you can enroll at any time during that 30-month coordination. But there again, we do encourage people to make sure they have it in place at the end of that 30-month period. If a person does enroll in Part A, but denies Part B, then they will have to enroll in Medicare Part B at the next general enrollment, and they may end up incurring a penalty because there is no special enrollment to get Part B started based upon this 30-month coordination period. If a person enrolls in Part A but doesn't take a Part D, a drug plan, then it would depend upon if that group plan, the employer plan's prescription coverage, is considered creditable or as good as Medicare's coverage. Then there would be a special enrollment to be able to get Part D started. So what's important about having ESRD Medicare is that transplant medications, if a person has a transplant, if that transplant is covered under Medicare, Even if they only had Part A, if they had Part A at the time of the transplant, and the transplant was at a Medicare certified facility, then when the person has Part B, then Part B would cover the immunosuppressant medications that would be required after a transplant. So that's an important factor to note, why it's important to have Medicare A and B in place. However, if a person doesn't or fails to get it, even though we know we can backdate Part A up to 12 months, if the person fails to do that, and that's happened, immunosuppressant drugs will be covered by a Medicare Part D prescription plan. The cost would vary depending upon the plan they're in, but that is also another reason to contact your state's SHIP program, state health insurance program, to help review and understand the drug programs to know which one would cover the best. So then when coverage for ESRD ends, when a person no longer needs Medicare, let's say a person got ESRD Medicare because they were on dialysis. If they no longer need dialysis 12 months after dialysis ended, then ESRD Medicare would end. Or 3 years, 36 months after the month of a kidney transplant, then at that point, Medicare, ESRD Medicare would end. So when you think of it ending, and maybe the person was not on disability, so they didn't have Medicare start based upon disability, or they were not 65 or over, so they're not eligible for the aged Medicare, then they would go back to the prior coverage, whether they have an employer plan or what other coverage that they had prior. But if they're of age or disability or 65 or over, then that Medicare would continue. We're only talking the ESRD status. Sometimes, though, Medicare would have to continue if a person restarted dialysis again within the 12 months, or they needed another transplant within 36 months. Then the person would be able to retain ESRD Medicare. And if it resumes, there are no longer any other waiting periods, no more 3-month waiting period before it could begin. So those are good things for people that may end up having to start ESRD all over again. So how does it work with other coverage? ESRD Medicare and a Medicare supplement. You may have seen another presentation at this conference that talked about Medicare supplements and those type of coverages. A Medigap policy is a policy designed to pay the out-of-pocket after original Medicare. It would help cover the deductibles or the coinsurance after original Medicare. In some states, however, people with ESRD or under the age of 65 may not be able to purchase a Medigap policy. This is where you need to, again, go to your state SHIP program and ask questions over what are your options in that state. If available, a Medigap policy may have a higher premium cost. So that's where checking out with that SHIP would really help you understand. Everybody gets a 6-month open enrollment at age 65 to be able to get a policy purchased in your state or area. In some states, and in my state where we're at, people under age 65 or ESRD are able to get supplemental policies. And these are policies designed to pay the out-of-pocket. So that is one option for people to look at with ESRD. Another option would be a Medicare Advantage plan starting this year, January of 2021. Beneficiaries with dialysis on ESRD can get their Medicare coverage through original Medicare, or now they can enroll into a Medicare Advantage plan. Prior to this, there may have been a special needs plan targeting ESRD, but now all Medicare Advantage plans can accept a person with ESRD. A Medicare Advantage plan must cover all the services that original Medicare would have covered. It would help. There will be out-of-pocket costs. There are beneficiary rights and protections. With an Advantage plan, there may be provider network choices. So you need to understand the networks of any plans you're looking at. And there may be added benefits. And there may be extra benefits, vision, hearing, dental, in whichever plan you're looking at. So you do need to, again, here, look at all the different options of the Advantage plans, if that's the route that you're going, as to what your out-of-pocket costs would be, and also what the added benefits would be, and if your doctors are in that network. If a beneficiary enrolls in a Medicare Advantage plan during open enrollment, but sometimes you hear of something else that would work a little bit better, or you change your mind, there is what is called the Medicare Advantage open enrollment period, which is from the first 3 months, January 1st through March 31st. You can also switch back to original Medicare or switch into a different Medicare Advantage plan. If you decide that there are some issues with the plan, or that it's not providing the services you need, contact your SHIP program. They may be able to help you look at other options, other availability to try to help you with any issues that you may have. That's what the SHIPS program are very good about, helping out. So now you've heard about Medicare supplements and Medicare Advantage plans, and now I'm going to talk about the marketplace coverage. A beneficiary who happens to be in a marketplace plan and they end up on dialysis or ESRD, they may elect to keep their marketplace plan, including the premium tax credits, instead of Medicare underneath these conditions. If a person would be required to pay a premium for Part A, they don't need to go on to Medicare. They can stay with the marketplace plan instead. But if a person hasn't enrolled in Medicare yet, they also are able to stay with that marketplace plan instead of taking Medicare. However, it's my understanding that there may be some states that have a provision where if you're eligible, they're going to assume you took it. And this is one of those issues that we've run across to help assuring people are able to keep the coverage according to each state's rules and regulations to make sure that they can get the coverage at the best cost. If a person's in a marketplace plan and they've got some tax subsidies, that cost may be much less than if they went to Medicare, purchased a Medigap policy plus a Medicare drug plan, especially if they're not eligible for further assistance for that. So it's very important here to also work with your state SHIP to be able to do that. So if they're not on Medicare, this may be an option for them to stay with. ESRD, Medicare, and Medicaid. Medicaid may help cover dialysis treatments if a person is low income or if the beneficiary does not qualify for Medicare. Incomes must be below a certain level. Again, check with your state. Each state has different eligibility levels for the different Medicaid programs. In some states, the Medicaid programs may coordinate and pay some of the costs with Medicare. That doesn't cover what Medicare doesn't cover. But some states enrolling into Medicare may make the beneficiary ineligible to remain in or go into other certain Medicaid programs. So they need to contact their state medical assistance Medicaid office or their state health insurance assistance program prior to enrolling in ESRD Medicare to understand the impact Medicare would have on their current coverage. That's very important for any of these, is to understand current coverage before making that decision to sign up for ESRD Medicare. And in some cases, ESRD Medicare is vital. If there is no other coverage, or if you have poor coverage, or if you're looking at needing that transplant. Very important to understand that. So the decisions. This is the important decision. Do I or do I not need to enroll in ESRD Medicare? Some of the questions to really understand: what is the current healthcare coverage the person has? Is this an employer-sponsored plan? Are they on Medicaid? Do they have Marketplace? What is the impact on that current coverage if they do sign up for ESRD Medicare? What's going to happen with the out-of-pocket costs? What's going to happen with the premiums or the loss of coverage? The beneficiary needs to understand the timing of enrollment into ESRD Medicare, knowing what's going to happen down the road. We've helped people who were not on a transplant list, but then they found out that they're now on the transplant list. We can help them time when to sign up for ESRD Medicare so that they have Medicare at the time of that transplant. Or understanding that 30-month coordination period to know when do you need to sign up for ESRD Medicare. These are very important areas to make sure are understood before signing up for this. A beneficiary also needs to understand their state status with presumptive eligibilities. Where Marketplace coverages or employer coverage can assume and pay claims as if the beneficiary has enrolled into ESRD Medicare. We have recently had a couple of situations where we did work with our insurance commissioner's office to help us resolve these issues for the beneficiary. This is a trying time for them. They're going through some major health issues. So understanding that and understanding what your state's views on this will help in assisting a beneficiary or help the beneficiary themselves understand what they need to do. So please contact your state insurance department for more information on the state's requirements. I have a list of resources here. This is where this information came from. Feel free to look up all these different sites and read up more about kidney dialysis and the transplant benefits that are available for a Medicare beneficiary. So if you do need individualized counseling and assistance with your Medicare choices and coverage, I want to encourage you to contact your SHIP program, your state health insurance assistance program, for questions. We are always available. We have counselors. There are staff available to help answer your questions and help you know what works best for you. Again, I want to thank you for coming to this health fair. Even though virtual, we're still here to help and provide as much information as we can. Thank you very much.